The lives of a teenage footballer and a runner in his 40s have been transformed thanks to pioneering science right here on your doorstep. We have one of the only clinics in the world that specialises in working with young people with arthritis, and it's been going for 10 years. Just before he was about to run his first marathon, Derek Ludlow was diagnosed with the condition, and he was only 46 years old. James Kitchen has been to meet him at the Nuffield Orthopaedic Centre.
I was training for the London Marathon and I pulled up after my final long run. The very next day I couldn't walk, I couldn't run, I couldn't get to the bottom of my drive. I went to see a sports injury person and he diagnosed it as piriformis syndrome, and he said, I can fix you, and he turned me around and put me back in, and I ran out the next day in a bit of pain but thinking, he's fixed me, but no.
In 2017, Derek Ludlow discovered he had arthritis at the age of 46. After at first being misdiagnosed, he was eventually referred to the Young Adult Hip Service at Oxford's Nuffield Orthopaedic Centre, headed by Professor Sean Glyn-Jones.
Everybody just kept saying it was piriformis syndrome until I came to see Professor Glyn-Jones when they did an MRI.
And were you surprised by the outcome of that scan, that a marathon runner could suddenly be told that they have arthritis?
I'm no runner. Oh my goodness, I was doing it for my best friend who had sadly died by suicide, so I was running in his memory at that time. But I trained hard to do it. Was I surprised? I was surprised I'd ripped the cartilage.
Faced with a hip replacement, Derek instead opted for a new stem cell surgical trial, which he says made all the difference.
It was kind of instantaneous with the surgery. Almost the next day I felt better. People say miracles, but honestly, I was in so much pain before I had surgery. He'd kind of fixed that problem overnight, which was just truly amazing.
And before you had that surgery, what kind of impact did this have on your mobility, on your life?
Yeah, it's interesting. Coming up to the marathon, I dropped nearly 5 stone. This injury, I put that all back on. I couldn't run, I couldn't bike, I couldn't swim. I've still got a brand new bike that I spent a fortune on that sits in my garage that I haven't been able to ride because the injury had affected me that badly. It had knocked my confidence, it had knocked everything.
Derek told me the work at Oxford's Orthopaedic Centre has given him a brighter future.
If you can save someone's hip, like mine's been saved, the cartilage is regenerating, I'm out of pain, I can go back to normal activities, I can sit for longer, I can stand for longer. My life's changed.
If you thought, like I did, that it was only elderly people who are affected, think again. 15,000 younger people live with this condition, according to the latest figures. Dr. Stephen Simpson is the Director of Research at the charity Versus Arthritis, which funds a lot of this work. Good morning to you, Doctor. Thank you for coming on, and a Happy New Year to you. How likely are you to develop this condition, arthritis, as a younger person?
Well, as you said, a lot of people think of arthritis as a condition you get in older age, and of course that is true. And it's less common in younger people, but I think it's underappreciated that in fact it is there. Whether we think about juvenile arthritis in children and young adults, or in the case we've just heard, a younger adult, 2.7 million people under the age of 35 have some sort of arthritis-related condition. So it isn't uncommon, and I think it's really important that we all understand the impact it has. But it's a term that covers many different forms of musculoskeletal disorder, so we also have to understand the impact of children and inflammatory arthritis, as well as the case of osteoarthritis that we just heard in the marathon runner there.
It must be a shock, certainly for younger people, to be diagnosed, to hear that word and think, goodness, am I aging before my time? That must be quite frightening.
I think it is, and I think in particular when we think of children and the families of those young people as well, all who have to come to terms with what can seem like a devastating diagnosis, and one that they would associate normally in older people. But we're doing a lot at Versus Arthritis and also with the partners in Oxford to understand this, and I think that brings a great deal of hope. And I think what we understand from that is that while it can be a shock and people feel, why am I getting arthritis at this age, that people can feel that they understand and that society starts to understand arthritis. And knowing that an organisation like Oxford and a charity like Versus Arthritis is in their corner, we can start to help them understand and incorporate it into their lives and think about it in those terms.
And I'm intrigued that it seems that it's something that physically active people have a tendency to end up with. Have I got that right? Is that the case?
Well, I think there is an association, of course, between sports and exercise, and one of the centres that that we fund in sports and exercise and osteoarthritis versus arthritis. One of the is partly being led out of Oxford, and that is to understand the interface between exercise and sport and the development of osteoarthritis. And that relationship between the two is really important to understand. It doesn't mean that if you exercise, you inevitably get OA. Quite the opposite. I think what we need to realize is that exercise is good. Regular exercise is vital for health and keeping joints healthy. But we do need to understand the relationship between sports, which can put pressure on the joints, and understanding the impact that might have on developing osteoarthritis, but also understand the positive impact, the other way round, if you like, that exercise can have on our joint health. And that's the two-way relationship is crucial. And that's some of the research that's happening in Oxford, and some of that is being funded by us.
Really interesting. Good luck with the work you continue to do, Doctor. Dr. Stephen Simpson there from the charity Versus Arthritis, and some of the groundbreaking medical science taking place right here on your doorstep in Oxfordshire.